Welcome back. Well, World Stroke Day is Sunday, observed every year on October 29th. It's a day dedicated to raising awareness about strokes. And today we have Dr. Michael Crimmins, who's a health expert with the American Stroke Association. Thanks for being here today.
Well, thank you for having me, Kristen.
An amazing statistic, actually, that I want to kick off with that I had no idea. More women are actually affected by strokes than breast cancer, you were telling me.
That's correct. So the number of women who actually die from ischemic stroke is 2 to 1 in comparison to breast cancer. And so that's a quite remarkable statistic.
And what is that from? Why is that?
There's multiple reasons. Stroke affects every fourth or fifth person in the United States will actually have a stroke at some point in their life. And if you actually think about that number, that's really a big number.
And what are the signs to look out for?
So the signs of a stroke that we like to tell is fast: face, arm, speech, and time. And so when we think about that, arm weakness, leg weakness, the inability to speak, and then the last step is time. So calling 911 and getting to the hospital as quickly as possible so that we can do interventions on that.
When it comes to strokes, everyone, of course, has heard of a stroke or, has maybe known someone that's gone through it. But do you think there needs to be more awareness about this day?
Absolutely. I mean, the impact is massive. So it's the 5th leading cause of death in the United States. It's the leading cause of long-term disability in the United States as well. And so when we think about disability, there's a lot of people living with stroke as a survivor. And we would like to stop that from the first place, and a lot of that comes from prevention and timely treatment.
Talk to me about the different types of strokes. I know one of them is the ischemic stroke, and that's the most general one, right?
That's correct. So the most common stroke is ischemic stroke, where a blood clot actually lodges into the blood vessels of the brain. This can come from the heart or be a blockage somewhere in that line. And then there's a group of patients who the blood vessels actually rupture and they start bleeding into the brain, and that's called a hemorrhagic stroke.
And that's your specialty, right? That's what you look out for, and you try to help people and save their lives.
Absolutely. And so every day we spend time as an interventional surgeon of actually trying to remove the blood clots from people's brains as fast as possible, of treating the aneurysms and other things that cause hemorrhagic strokes. And that's what we do every day.
Wow. How does it feel to be able to do that for somebody?
I love my job. I think it's fantastic, so I wouldn't choose anything else.
Amazing. Thank you so much for being here today and raising an awareness for a very important day, Stroke Day, World Stroke Day, which is going to be the 29th again on Sunday.